What you have here before you is about 75 years of collective wisdom of physicians walking in the trenches, really trying to disrupt the status quo. When I was thinking about that, and I thought, is that an oxymoron, physicians trying to fix healthcare? I don't know. We can't even get people to wash their hands. But this is a panel of physicians who have taken the path less traveled and have really been trying to make a difference in healthcare for the better. And just when I thought we had made a dent in it and that I could quit and go bake bread or hang out in Sonoma, I get a call last week from my 85-year-old Swedish mother-in-law in Minnesota who was so proud of herself that she had spent 2.5 hours online filling out all the forms for my father-in-law's appointment in surgery the following week. So she goes in last week for the appointment at 5:30 because they told her to show up at 5:30, which is crazy why we do that. I said to her, nothing will happen at 5:30, it'll happen at 6:30, but she showed up at 5:15 because she's Swedish. And anyhow, she gets there and she walks up to the desk and checks in, and they hand her a clipboard with all the same paperwork she'd spent 2.5 hours on the computer filling out. So she calls me up and says, Bridget, why haven't you fixed this yet? So that's what this conversation in this panel is about, is what does the Hospital 2.0 look like? How will patients interact with the system going forward? And it will take leaders who have really stepped off of the path and are not 9-to-5 normal physicians. This is not a normal panel either. So Jay, let's start with you. You trained at Hopkins, you're a pediatrician, you could have taken the normal path. What is it that you saw? What is it that led you to create and lead the company that you're building today? Tell us your story.
Sure. Well, I mean, I'm just kind of the type of person that's just kind of intolerant of bad. So it was very easy for me to look at, and from an inside perspective in the healthcare system, and be like, this is really broken. The process of healthcare delivery is unnecessarily complex. People want something different. The other components of our society are giving them something different, and healthcare is 20 years behind. So I just figured I had a few mentors that were like, here's a better process, and I just figured I could design a better process and make a business out of it.
Tell us a little bit about Sherpaa and what it does.
Sure. So we procure health insurance for companies, and that solves half the problem. The other half is access. So we give each employee at our companies 24/7 access via our app to our group of concierge doctors that we've hired. So 70% of the time when you reach out, you have a problem. We solve that problem. We don't refer into the crazy healthcare system. It stops with us. So that means 70% of claims go down. Your company looks super healthy. Next year's premiums are lower because of that. So we're all about making healthcare affordable and accessible.
Great. So Pat, 30 years at Kaiser. You're a geriatrician. You're an internist. You lead the Kaiser Permanente medical group. What is it that you witnessed or saw that helped you take a path less traveled, and what is it that you're working on today within Kaiser?
Well, thanks. And a little bit different here than Jay. I chose to practice within a large system of care. And in the course of the evolution that we've all seen in healthcare over the last 30 years, what was initially an individual practice within a large group became a population-based practice in many ways. And one of the things that I saw early on was that as we attempted to really advance quality, we deliberately, but frankly, in a problematic way, created all these metrics. And individual physicians were heroically trying to manage all of these metrics while they're taking care of their patients. And it seemed that there were opportunities, particularly within a larger system, to create processes to support the clinician in managing those things. And that's eventually evolved into our population management processes. But there's more than the system. There is actually engaging the patient. So when you begin to identify the things that are important to improve quality forward, you begin to share those broadly within the team, not just the physician, but also with the patient. So whether or not someone is due for a mammogram is on the patient's registration slip for them to see, as well as for the nurse who might be talking to them when they call, as well as the staff at another department. And the goal is to leverage the system and to use technology to do that to achieve better quality and better health outcomes.
Great. I probably get a call every other week from a recruitment firm telling me that they want to hire the role of a chief experience officer in healthcare. Found about 30 physicians that have that title. The second fastest growing role is the CMIO, the Chief Medical Informatics Officer. We've actually convened a group of these leaders together in a collaborative to design the next or leading practices that will humanize the way patients interact with the healthcare system. So in your experience, Jay, could you give us an example of the impact of your innovations through your company, how it's changing the way patients interact with the healthcare system and with their doctor, and give us a concrete example to make it sort of come alive for us?
Sure. Perfect example, I'll give you two. Someone reached out to us via our app describing classic appendicitis. So we forwarded that message on to our general surgeon, who's in Union Square. We're based in New York City. Dr. Evan Goldstein is our general surgeon. He said, send this gentleman right over. So we sent him over to his office. Evan examined him, thought it was appendicitis, did a CAT scan, found it was positive for appendicitis, and they set him up a room because he also has a surgical suite in his office. And he laparoscopically removed this gentleman's appendix. And 3 hours later, sent him home on oral antibiotics. So from contacting us to being home minus an appendix, it was about 6 hours. That costs, if he would have done that procedure at one of the large hospitals where he does that procedure, they bill about $110,000. He billed $40,000, right? So if you're a company, I just saved you $70,000 essentially, just by coordinating, just 5 minutes of my time, right? So that's another classic example. Another one is, somebody reaches out to us. We think he has a pneumothorax, which is a hole in your lung. It can get pretty serious. You have to get a chest x-ray. So we could have sent him to the emergency room, where he might have sat for a couple hours before getting a chest x-ray. We could have sent him to urgent care, where he might have sat for an hour before getting chest x-ray. Or we could just send him right to the radiologist and get a chest x-ray, have the results back in 30 minutes. So that's what we did. It's a $40 chest x-ray. And we got the results back, and he's good. We ruled it out. So these are just classic examples. I mean, yesterday, as mentioned, that the CMS was doing studies saying that 70% of things can be done, with good communication. That's what we're doing. And the interesting thing about this is we've hired our doctors. Our business model is our companies pay us $50 a month per employee to take care of their employees, and that's how we pay our doctors. So we're paying our doctors not for office visits and procedures, we're paying our doctors for communication. And that's really, to me, the most important change in American healthcare that needs to happen.
Okay, so Jay just hit on what I believe is the single most broken thing in healthcare, which is communication. And at the Cleveland Clinic, we found that that was the #1 complaint from patients across our entire enterprise. In fact, it's the #1 complaint in any healthcare system. Things like never knew who my doctor was, never knew what the plan of care was for the day. One of the things that absolutely drives me crazy is that we take a piece of tissue from a person's body, my brother's prostate, my sister-in-law's breast, to see if they have breast cancer or prostate cancer or an image of the head. And my family members will say to me, well, I haven't heard from the doctor. Should I assume it's normal? And I'm like, God, no. That doesn't mean anything. And I'm so frustrated because you can order a pizza and Domino's will send you an update on your phone that it's, been ordered, it's being tossed, it's in the box, it's on its way to you. Yet you take something out of my body and I have no idea where it is. So Nobel Prize to whoever comes up with that innovation here. I'm working on it with my team. But Pat, tell us about some of the innovations you've done with Kaiser to get, as we talked about big data, how do you actually get it into the hands of the patient? It's their life. And then how do you help them do something with that information?
Well, a couple things. I think that, first of all, I just want to go back to Jay's comment. I do think that there's a critical step in advancing quality, efficiency, and personalization of care when we connect our doctors and frankly, when we connect the entire team. And a lot of that has to do with whether or not you're a capitated or a fee-for-service model. And we really have to start thinking about how we create incentives that align people to do the right thing for the patient. In that spirit, and a follow-up to your comment, we are looking at several ways of engaging our patients differently, and in fact, trying to provide the same kind of service that people expect if you're going to book an airline ticket or take a trip. Medicine has really hung back as though we're not a service industry, and in fact we are. So several things that we try to do is we try to offer people choice. And one of the things along that thread is we've developed an app, probably not as good or fancy as any that you all have developed, but it is a little bit unique. It's called Preventive Care. And what it does is it tells a patient that they're due for a service. They get a little push notification, they open up, they see what it is. It's obviously customized to them, it's just for them, it's based on our knowledge of their care and what they need. The unique thing is when they open that up, they can book that service right then. They don't have to write a note and say, I'm going to call the office tomorrow when they're open. From that application, they hit a button, they see what the appointments are, and they can pick one and they can book it. It's a small step, it's a small innovation, but it's bringing care to the patient on their terms for them to choose in a way that they can integrate it with the rest of their life. And we think that that's going to be a critical focus of how we evolve healthcare that actually works for people and makes it possible for them to do the things they want to do within the context of their life.
I think what you and Jay have just said, I mean, the critical part is connecting all the people with the right communication at the right time and really putting the patient at the epicenter of that communication. I keep thinking there's a lot of talk about interdisciplinary or multidisciplinary rounds, and I keep saying not in my lifetime am I going to see the neurosurgeon rounding with the physical therapist, with the internist at the bedside. So the innovation that we're developing at our company is virtual bedside rounds where the patient can beam in the specialist and understand what the plan of care is for the day. Or I was telling Pat, who's a geriatrician, God love her, we need more in the country caring for the aging population. My father is this week in a rehab for a knee replacement, and after 10 days, nobody knows the plan of care. So I say to him, open your little flip phone, put it on speaker when they round, and connect to my iPhone. So yesterday at 9 a.m., I'm doing the care rounds with the 10 people around him. I'm in San Francisco, he's in Wisconsin. By the time we get done with the discussion, I helped them stop putting him on 2 drugs that have known side effects and gave them a piece of information that wasn't in his medical record because the 2 medical records don't talk to each other. And I said, great, I'd love to round with you by phone virtually. We're creating this. There's a great woman company at UCSF called Share the Visit. I'll do it tomorrow, 9 a.m. Deadly pause in the room. One speaks up and says, well, how about if we call you at the end of the day? We have a lot of patients to see, and this might slow us down. I thought, let's see, I might have just saved 2 adverse events mid-air, but the technology might have slowed them down. So I think great opportunity to connect people through the best communication, but one of the questions that I have been asked, and just recently in an interview, is this question. And let me just advance the slide to see if you can see it. My friend Bob Wachter at UCSF shared this slide with me. It was in JAMA last year. The question is technology dehumanizing healthcare? And Jay, with connecting just through texting and email without a visit, is technology making us less human? And what should we do about it as we think of innovations in this room today?
Well, it's a great question, and in fact, I think the answer is yes and no. At least in Kaiser Permanente and everything I see and read, patients like the ability to email. They like the ability to look at their information online. So technology is helping us and helping patients manage their health. But in the interaction with their physicians, and frankly other clinicians as well, we're hearing over and over again, and I see it myself in the office, that the middle of the room is actually occupied by the computer. The patient and the doctor are both working with a computer, and we have to figure out how to get from a situation where the doctor's got one ear listening to the patient and our eyes and fingers are on the keyboard and the monitor. Patients don't like that. They don't feel connected. Many of them have chosen to meet their care needs by texting, by email, in a variety of ways. And the time they chose to come in for a visit with us, or we said, you know, based on what you just sent me, that picture, I need to see that, they expect our attention. And we need to figure out how to use the technology better. We also need, and I can only speak to the EMR we use, it is a fountain of information. Everyone who works with it loves the information that's in the EMR, but it is not at all built with the individual who has to input that information in mind. It's arduous, it's clumsy, it's time-consuming, and we really need to rethink that relationship with the companies that are producing our EMRs and make it easier to use the EMR in order to have that doctor and the rest of us actually retina to retina with our patients when they've chosen to come in.
I meet more doctors my age who want to quit, retire, go do something else because of the burden of how complex it is to deliver medicine. And I just read a survey yesterday that the number one most rewarding thing about medicine for physicians is the relationship they have with their patients. And the survey also asked, would you recommend your daughter or son to go into the field of medicine? The majority said no, which is really disheartening for me because I still feel it's one of the greatest professions ever. But Jay, one might argue with your company and the way you connect with patients through texting and email and not a human encounter. Does your technology keep a relationship, or is the technology dehumanizing?
Well, I mean, I think it absolutely makes the relationship significantly better. Basically, what we've built is like an IT help desk for healthcare, right? You create a case, we solve it. Sometimes we solve it in-house, sometimes we refer. And what's interesting about this, that's the doctor side. And on the patient side of things, you just have a profile, and then you're like, I'm sick, I'm hurt, I have a health insurance question, I need a referral, I need a refill. And we get this is really interesting because we set it up with like a big blank text box, right? And we're finding that people will write us paragraphs. And then we'll get that, and we've created sort of standardized questions. So if you come at us with a sore throat, everybody gets the same 10 questions. So we're standardizing history taking over the internet. So people answer those questions. We might have a few more questions. And so it changes this concept of the doctor visit from this 7-minute, rushed, stressful, you're sick, you've been waiting for an hour, you're angry, your doctor doesn't have a lot of time for you, and to a sort of stream of communication that might happen throughout the day. But what that does to me is I just think it's nonsense that you might go see your doctor 3 times a year and spend 7 minutes with that doctor. What we try to do is just change that conversation from that very finite incremental thing to an ongoing conversation that can happen at any time with you as needed. So I think that to me is extremely humanizing because it gives you the opportunity to say what you need to say without the constraints and the stress of having to immediately answer. And I think that's really important.
One of my mentors is an engineer, Earl Bakken, the founder of Medtronic, and 20 years ago, in my last month of my residency, he said, Bridget, as you start your career, remember one thing, that only 20% of healing is from the technology he helped invent, the pacemaker. You also have to focus on the other 80%. And I think what you two have really both just said is that there are ways for you all to come up with innovations and technology that enable the human experience and enable better outcomes. And there are ways we could improve the way we use the EMR that are different than the way we do today. Going forward, and maybe as sort of a call to action for the inventors in this room, as you look at ways that the experience is so broken and fragmented today, and what patients really want is a consistent, seamless journey of care from the first impression to the last, outside the walls. We've tried to innovate around some innovations. I think one of the most broken things universally is the discharge process. First of all, why we even call it that? Is that pus or exudate, or why do we even call it that? But anyhow, it's instead of 50 sheets of meaningless use paperwork, because of one nurse, we came up with a way to audio and video record the discharge instructions at the bedside. And then the family can designate a navigator or their PCP that they want to receive the information and can listen to and replay the instructions at home. And it's my belief, we haven't measured this yet to show the ROI, I believe re-listening to the voice of their nurse creates a connection and trust relationship. We also know it's improved costs because it's decreased readmissions. What do you think is one of the best ideas that you've seen that should get advanced or funded and go faster to change healthcare? Or what is one of your observations of what's still so broken and would be ripe for innovation that we could challenge this room to help us go fix? Jay, let's start with you.
Sure. Well, along the lines of what you said, I'm just going to say something about myself first and then healthcare. People forget 85% of what their doctor says, you know? So just having that record sort of it's very similar to like the Facebook news feed of like your conversations that you've had with us and your doctors, you know? It's just having the ability to log in and just be like, here's what medications you're taking, here's the person you need to go see, here are their hours, click here to make an appointment. You know, it's like a very, you know, just clear, here are your next steps, right? So I think that's really, really, really important. However, now innovation in healthcare and like what's most important and all that stuff. I think I like to split this up into health and medical care, and that's a huge distinction. Oftentimes whenever you have doctors, that's medical care, it's not health care. And so the innovations that I see that to me will really impact our nation's health is not so much from the medical side of things, it's from the health side of things. And it's really fascinating to me to look at the Whole Foods movement. And you know, whenever I was a kid, I mean, whenever we went out to get some, you know, a quick meal, it was like Arby's or McDonald's, you know? Now it's like, you know, Panera Bread or something like that. There's a movement away from this sort of processed food to like real food. There's a movement toward just being more active. You know, this wasn't really part of the conversation whenever I was a kid. And, you know, it's interesting to think because in 1964, the Surgeon General came out with a report saying that smoking is bad for you. And that was when 50% of the population smoked. Now it's about 11% in New York City, but that took 50 years. So this is going to be like small incremental changes, but I think what's really fascinating is the conversation around obesity, activity, good eating is pretty much like just getting started. I'm really hopeful for that.
Well, and you're so right. I mean, it seems so slow. Earl Bakken, who's 90 in January, calls me every 2 weeks and says, Bridget, go faster. Healthcare is still so broken. So Pat, in your experience as a geriatrician and at Kaiser, what do you see as ripe for innovation as you sort of look out at your life and practice as a doc?
Thanks. Just to sort of follow Jay's comments here, I actually think there's an area in which there's genuine urgency. And if we look at the rate of escalation of healthcare costs, it's really something that can't continue. Everyone talks about that. But if you also put alongside it the graying of America, the fact that we have this huge population of individuals who are entering a period where utilization of healthcare remarkably increases, we have to really think about how we're going to do that differently, both to provide the care that they need and two, not to bankrupt our country. So I think that that is a space in which there's huge opportunity for technology. I think one of the earlier panelists commented on the medicalization of life. And in fact, some of the innovations that you all might bring forward could really be in the area of connecting that graying population, I'm soon to be one of them, with the community. How do we leverage technology to leverage our communities to keep people healthy? I think this is actually an area of which there is some urgency and we do need to move faster. And I think the ideas are just beginning to percolate and would really benefit from some real thinking from some very smart people.
Thank you to the panel. Fantastic.